Good afternoon. My name is Kamlesh Kaur and I'm a public health educator with Stanislaus County Public Health. This is your COVID-19 update for Thursday, September 17th. As a reminder, this video update is also posted on Stan Emergency Espanol page on Facebook. The data in this update is also available on stancounty.com/coronavirus. As of this recording, we've had 16,077 positive cases of COVID-19 in our community. We currently have 102 COVID-19 patients in our hospitals, and 28 of those patients are in our ICU units. Our hospital remains in critical condition. As of yesterday evening, we have lost 321 members of our community to this disease. Our sincere condolences go to those who have lost their loved ones. As we move towards the holiday season, especially Halloween, I wanted to remind our community members of the importance of practicing safe behaviors as we interact with different friends and family members. Over the past couple months, we have seen our numbers grow in ages below 44. This group accounts for about 60% of all of our cases, meaning 3 out of 5 young adults had COVID-19 in our community. It's important for young adults to realize that COVID-19 could affect them and that they should take precautions so they don't catch the virus. In addition to endangering their own health, more coronavirus infections among young adults could mean more risk to our elderly population, who are still the group most likely to die from the disease. While most in our community have practiced social distancing in many ways, one practice adopted by many among the younger population is by forming social bubbles or pods to maintain a smaller group. Social bubble is typically defined as a group of people with whom you maintain close physical contact. This graphic is one example of how this scenario can turn into a cluster case if not practiced responsibly. You may have formed a tight social bubble, but there may be others within your circle who also see people outside your group or household. Your individual household may also include those who may be over 60 years of age, have a chronic condition such as diabetes and cancer, or is an essential worker who could spread it at work if they contract the disease. When one person in your group gets infected, you can potentially become an asymptomatic carrier who could pass it on to this vulnerable population. As we all eagerly look forward to this holiday season, we must remain vigilant in taking precautions in protecting those around us. You can start by keeping your group smaller. Stay home if you're not feeling well and get tested. Avoid close contact. Leave 6 feet between you and those who are not a part of your household. This advice might reasonably be extended to tightly knit bubbles. Wear a cloth face covering and please ensure that it covers your mouth and nose. While it can offer limited protection to those who are wearing the mask, it is intended to protect others in case you are infected. Wash your hands frequently with soap and water for at least 20 seconds. If you don't have access to soap and water, please use a hand sanitizer that contains at least 60% of alcohol. Whatever strategy you might consider to stay in touch with your friends and families, to reduce the chances of contracting COVID-19 and potentially infecting others in your individual bubble, we must continue following these precautions. Especially now, as we continue to open our elementary schools precautiously and with potential to move through the current tier if our numbers continue to drop. We have done well in the past couple weeks in slowing the spread. Let's continue to stay the course. Our actions can save lives. United, we will win against COVID-19. Thank you for watching. Please tune in on Monday, September 21st for our next update.